Hey, I'm Dr. Gujarati. I'm the medical director of the Parsa Mohebi Hair Restoration clinic up here in San Francisco. Everybody calls me Dr. G. It's sometimes just easier to say. I don't mind it at all. My specialty is in hair restoration surgery. I'm a trained facial plastic surgeon. I'm also board certified in head and neck surgery, ENT surgery, but I've chosen over the last 15 years to slowly specialize into only one thing and doing one thing really, really, really well, and that's hair transplant. Let's talk about whether FUE is better than FUT for everyone. Let's define those two things. FUE is the modern transplant where we're excising one follicle at a time as we work. FUT is what used to be known as the strip method, cutting the back of the scalp and taking a big piece of skin out and cutting the hairs out of that. Look, there is no blanket answer to saying one thing's better than the other for every single person. What I like to tell patients is, look, everything in surgery across the board of medicine is going towards minimally invasive. We know that it disrupts the body less, it's less painful, it heals quick. And I tell patients all the time, if you had to get your appendix out and you went to the hospital, you know what they're gonna do? It's called laparoscopic surgery, operating through tiny little incisions in your belly. You know what they used to do 30 years ago? Slice your belly open. Is that what we're doing for everybody now? No, absolutely not. But when laparoscopic surgery first came out, it had to be learned. It was a new process. Surgeons that were doing it the old way had to learn the new way. And over time, what had been done for decades and decades transitioned to a whole new paradigm. And now the standard of care for getting your appendix removed is laparoscopic. So for hair surgery, it can be done either way. But what's going to leave you with a more natural looking results without as big a scar and with a lot easier recovery and less pain and a lot less complications down the line is FUE. FUT can still be performed, and there are very good surgeons who still do that. In my practice, I say I'm going to do what I am trained to do that's the best for the patient, and that's FUE. I can do FUT. I did for 20 years. But if it's me, what am I going to get? What did I get? I got FUE. And the results are still wonderful, and they're absolutely top-notch.